So I'd like to begin by introducing our guest speaker, a person who really needs no introduction. He has been a long-time advocate for children of our community. His face is as recognizable as the CHEO logo. I'd like you to join me in welcoming Mr. Max Keeping.
Merci, Joanne. Thank you, everybody. If Michelle and Joanne were reporting to the community, perhaps I'm the community reporting back to CHEO. I should tell you that I used to be Max Keeping at 6. CTV, however, has shown its commitment to the community by retaining me as the community ambassador. And I've been so busy since I left that I don't miss work. And it certainly gives me the opportunity to tell the CHEO story, though I suspect virtually everybody in this room could tell the CHEO story. But CHEO and this community is a magnificent story. And just stop and think for a moment. And in particular, the kids who are here tonight, I really want you to realize exactly what an amazing place that you're sitting in tonight. First of all, just think of your hometown. Ottawa has just been named by Money Sense magazine as the best place in Canada in which to live, to work, to play, and to invest. We've just been named one of the top 7 smartest communities in the world. And with 54% of the people in this city making their living from thinking, you can see why we would rank up there. We've just been described by the Washington Post as being very cool and perhaps even hip. We take the compliments, and we'll spread the word. We happen to be the most caring community in all of Canada, and this is the one thing that I would like the kids to particularly remember. There are 170 children's hospitals across North America, and on a per capita basis, year after year after year, our contributions to CHEO rank number 1 in North America. And what that says is the people who live here, the adults, think that your health is the most important part of this community. And any community that declares itself as children's health care as priority is certainly the kind of community in which you want to live. And one of the reasons for that generosity and support for the hospital is the hospital itself and the magnificent people who work here. This hospital, now recognized as one of the top pediatric institutions on the continent, the research center attracting people from around the world and doing some of the world's leading edge research into pediatric health challenges. The reputation is growing. And of course, that being able to attract medical talent from around the world means that they're here to treat those in my care. And so that the excellence of care provided by this hospital to our children, and they are all our children, is unparalleled anywhere in this country and across the continent. And CHEO has become the symbol of the quality of life in this community. And I can tell you, there was a man speaking this morning, and he said, I'm thinking of moving to Ottawa. And I said, what would be the first thing? This is a financial advisor, highly respected person in the country. And I said, what would be the first thing you want to know about a community if you're going to relocate? He said, I want to know about the Children's Hospital. And I said, I can tell you. Let me tell you the CHEO story. And when we sell Ottawa to people to bring their business here, to senior executives to come here, CHEO is the first thing we tell them about. That reputation is so strong. And that's a reason why we need to continue to support the hospital and the people who work here. And tonight, as the awards were about to show, the hospital looks outside its walls in caring about children's health care, in looking for fresh ideas on how to keep kids out of hospital. And it's always been a part of the emphasis of the care provided here at CHEO, is to try and keep kids from having to come to the hospital. And I think immediately of Planet Safe and how involved in many partnerships in the community that Planet Safe is, and the trauma unit of dedicating work to injury prevention. 1 in 5 kids at emergency is an injury. But that's a reduction. That's a reduction in what it used to be. And we will reduce it even further. This hospital is pioneering in the eating disorder program and the youth mental health program. This hospital leading the way with the Center of Excellence in Mental Health, our great outdoor playground, encouraging kids to exercise in fresh air. Joanne mentioned the obesity clinic, the ongoing research provided by the HALO group, HALO, Healthy, Active Living, and Obesity Group. And I want to tell you that within the next 6 to 8 months, you will see an amazing change in Ottawa. And it's led by the top researcher in the country on children's obesity. And this is going to be the first generation that dies before its parents if we don't meet this crisis head on now. And led by the research done here at CHEO and in partnerships across the country. You will be seeing the community partners funneling the focus into healthy, active programs. The United Way and the Ottawa Senators and other donors are putting a focus on let's get kids to be active. And we're learning how to do that from this hospital right here. I think of Dr. V and the Think First group. There's a young man named Trevor who was riding his bicycle, got hit by a car, slung into a ditch, and suffered severe trauma and brain injury. And Trevor makes almost as many appearances as Dr. V in schools talking to kids and saying, this is what could happen to you. And the lesson coming from one of their peers is even stronger. And I think it's just as important that the CHEO Advocacy Committee here working on issues like reducing poverty, providing adequate housing for children and their families, vitally important in the health care of children. So the leadership is right here. The community is so well served. But I couldn't sit down if I didn't say, you know, the real key to all that happens here are those people that I describe as the magnificent people who work in this place. And it doesn't matter whether they're an award-winning scientist, internationally acclaimed, or Dr. Joe, and the tremendous work that he has done. Whether it's the person who's the PSA on the ward, or the maintenance worker, no matter what you do here at CHEO, You're part of the team. You're part of the team that provides the care for the children who come through the doors. They come in huge numbers, 600 kids a day into the day clinics. These people treat your children the way you would do it, with the kind of love that you give to your children. There are so many stories. You know, in November, a young CHEO graduate is going to be named the Youth Philanthropist of the Year for Ottawa. As a CHEO kid, came in her at the age of 2 months, went all the way through to 18. Next week, he's now 21, he's going in for his 40th surgery. But the care that he received here has prompted him to fundraise on an annual basis for the hospital, and he's now surpassed over $250,000. A kid who wants to give back because the people here looked after him so well. The Canadian astronaut who's going into the space lab in 2012, Chris Hadfield. One of Chris Hadfield's greatest moments in life out on Earth was a visit he had here to CHEO. And when there was a little boy in the oncology wing who heard there was an astronaut coming, he got together with the nurses and he went to the nurses and said, I want a box. I want a box. Michelle, what do you want a box for? Just get me a box. And the staff in the unit got him a box, and when Chris Hadfield walked into his room, he didn't wait for the introduction, he just, I put my cancer cells in this box, Mr. Astronaut. I want you to take them into space. And with the staff, Michelle and Chris Hadfield went onto the roof here at CHEO, and they tied his cancer cells in the box to helium balloons and sent them into space. Michelle is, I think, 11 now. Michelle's cancer is in remission. And when I saw Chris Hadfield on the 1st of July, he remembered seeing Michelle here at CHEO. And my very favorite story is a little boy who was a teenager, 15, and he wasn't going to make it. God was calling him. And the nurse sitting with him in the middle of the night, just chatting, and she asked him, is there anything if you had the chance to do in life that you want to do? He said, yeah, ride in a convertible. She suspects he knew that she had a convertible. So at 3:05 in the morning, wrapping him up, they go out onto the parking lot. And she opens the passenger door. And he says, no, I said drive a convertible. So at 3:08 in the morning, the boy drives the convertible around the parking lot with a very caring, loving nurse in the passenger seat. God did call him shortly after, but he smiled, and he brought a smile to all those who looked after him. And I just use that as an illustration to guarantee you that when your child walks into the door of your children's hospital, CHEO, they will be treated with love. Can't ask for any more than that. We're very grateful for having CHEO in our community. Thank you very much for all that you do.